Kelsey Nichols, student ID 3470264, semester spring of 2020. We're going to be demonstrating how to do a saphenous venipuncture in a dog that is in lateral recumbency. Lateral meaning that the patient is laying on its side. Lateral is away from the median plane, so the patient's side is furthest from that. The saphenous vein is the vein that runs directly along the outside of the rear leg in dogs. So to do this, the patient is going to be directly in front of you so that you have the ability to come over the body with your arms. You're going to grab onto the front leg and the back leg on the opposite side of the body. Good, you're cute. And then you're going to gently allow the patient to slide down your legs while pulling those back legs out. Holding on to the bottom legs prevents the patient from being able to stand up, and then your front arm is going to be across the neck to prevent the head from moving too much. In order to do this venipuncture, the vein is going to be prominent directly across here on the bottom part of the leg. To prevent the patient from moving during the procedure, you want to secure directly above the knee up here on the stifle by putting your thumb in front of in the front part of the leg above the knee. The rest of your hand is going to come around to the back side to stabilize it. Apply pressure so that vein pops up down towards the bottom. The venipuncture can be achieved, and then to release, you're going to release your pressure first, and then you can allow your patient to stand. So we're going to be doing a cephalic venipuncture in a dog in a sternal position. Sternal meaning that the dog is in a natural position. The sternum is parallel with the ground. The cephalic vein is the vein that runs directly across the front of the front legs in dogs. And so we're going to find a corner for a dog, since it's a large dog, to prevent them from backing up while we're trying to do the venipuncture. To do that, we just gently guide them back into the corner. We're going to ask them to sit by putting pressure across the front of their chest and gentle pressure across the back. Sit there. Sit. Good boy. Okay. And the easiest way is to kind of cross your legs over the patient like so that they are sandwiched in between your legs to give you the most control over the patient. What we're going to do is we're going to take the head and we're going to pull it off to the side, bracing completely the head, and make sure you have the head and not just the neck, so that the patient isn't able to bring their head around to be able to bite anybody or get in the way. So bracing the head, you're going to run your hand down the front of the body with your palm on the back of the elbow, behind the elbow, to make sure that you have full control over the leg. Your thumb is going to come around the front, apply pressure, and then roll to the outside, and then lift the leg up. The vein is going to come straight up across here, and then to release, you can release your pressure first, gently allow your patient to bring their leg back down, release the head, and then allow them to stand. We're going to be doing a medial saphenous venipuncture in a cat that is going to be in lateral recumbency. Lateral meaning that the patient is laying on its side, and the medial saphenous vein is the vein that runs along the inside of the back legs. So what we will do to restrain the patient is, first we're going to get a scruff, like so. We're going to gently lift up on the front legs, and we're going to lay down to the side. We're going to use our arm to support the back. You can do a gentle stretch if the cat is kind of fractious, but in this case we shouldn't need it. We're going to grab the top leg, and we're going to grab the tail. We're going to lift those up out of the way. Sometimes on your fatter cats, you got to move the fat pouch. The bottom part of your hand right there is going to lay flat across the leg. And then when you apply pressure and the assistant pulls the leg straight out, then the vein will pop up directly across here on the inside of the leg by applying pressure. To release, you're going to release your pressure here, have the assistant release the leg, let the patient pull its legs back towards them, and then we can gently rotate the cat back up into a regular position and release the scruff. So first we're going to be demonstrating how to do a cephalic venipuncture in a cat that is in a sternal position. The sternal position is a natural position where the sternum is parallel with the floor on the bottom side of the animal. And the cephalic vein is the vein that runs across the front of the front legs. We're going to be occluding the vein by applying pressure to it. We occlude the vein to do things such as blood draws and IV catheter placements. So the first thing that we're going to do, First thing that we're going to do is get the patient to sit. And to do that, we're going to apply gentle pressure to the front of the chest. And we're going to use our shoulder to apply gentle pressure to the back of the cat. This gets the cat into a sitting position, like so. We would then have the cat lay down by pulling the front legs forward and again applying gentle pressure to the top of the cat. So to be able to do the cephalic venipuncture, what we're going to do is we're going to do a gentle scruff across the back of the neck, right here, just like this. And to do that, you put your thumb on one side, your pinky on the other, allow your hand to spread out evenly across the rest, and then just do a gentle pull together. The other way of doing this without having to scruff is just kind of pulling the head to the side. We're going to go ahead and scruff in this case. We're going to do a gentle scruff and we're going to pull the head to the side like this. The other hand is going to be back here behind the elbow. Behind the elbow where, so that the patient's not allowed to pull the leg back. Make sure you're not too far down so that if you are, the patient will be able to pull their leg back when you're trying to stick. So what we're going to do is we're going to take our thumb, we're going to wrap it to the front of the patient while using our arm to brace the patient's body against ours to prevent them from moving. The front, the thumb is going to come across, apply pressure, and then roll to the outside. What that's going to do is it's going to occlude the vein, but it's also going to pull it up to where the technician that's drawing blood is able to access it easily. To release, what we're going to do is release the pressure first, allow the patient to pull their arm back underneath them, release the scruff, and then we can allow the patient to stand up.